Mr. Lansley, we're not very happy with your plans for our NHS.
I can't imagine why not. This is what you guys have been asking for years. The freedom to run the NHS the way you want it.
But you're making it so complicated. And you're making it much easier for private companies to come in. All at a time when we're totally strapped for cash. It's going to be a disaster. What are you doing?
I'm listening. This is my listening pause.
Okay, whatever. Look, your bill is ridiculously complex. Hardly anyone can understand it.
I thought doctors were supposed to be clever.
Don't be snide, Mr. Lansley. Your bill takes 3 layers of NHS bureaucracy and replaces it with around 7. How can we afford that?
Well, you see, my bill, the biggest piece of legislation ever to come before Parliament, simplifies the NHS. This will save us lots of money. At the same time, we're opening it up to competition from the private sector, which guarantees quality. Look at the social care sector to see how good the market can be.
But look at what happened with Winterbourne View Care Home. The care was shockingly bad.
Yes, and the market dealt with them firmly. No one would put their granny in that home now, would they? Put the wind up the rest of them, I tell you. Market pressures are much better than relying on some bureaucratic regulator.
So the NHS is not going to be so tightly regulated in future?
On the contrary, Monitor will be strengthened as the regulator to make sure that the free market works.
So if this is all going to be so wonderful, why are the BMA, the RCN, the RCGP, and so many other healthcare representatives against your plans?
They're reactionary, and they don't understand the bill. They are the forces of conservatism.
Conservatism?
With a small c.
Aren't you going to respond to the concerns of the health professionals at all?
Absolutely. I identified the ones who agreed with me, and Dave and I had a little coffee morning for the Coalition of the Willing at number 10.
And what about those who disagree with you?
I will have them all sacked, one by one, until it's just me. And the Royal College of Surgeons, reforming the NHS together, led by GPs. Did you know, I have 50 GPs who said they agreed with me.
And what about the other 46,000 GPs?
They're just a vocal minority who are shouting down the 50 who agree with me.
There was nothing in your manifesto about this complete upheaval of the NHS. You said no more top-down reorganizations.
This isn't a top-down reorganization, because we don't do those anymore. This is an incrementalist approach, which I'm told can be seen from space. Isn't that something?
This is bonkers. You said yourself that this could all have been done without any new legislation. Why have you done this?
Isn't it so much more fun this way?